Good morning, good afternoon, good evening, colleagues. Thank you for joining us for this month's monthly Health Data Collaborative webinar series. We're very excited to have you all on board, and we're excited to present to you today. The HDC is growing in membership. We're very excited about this. We're now at over 300 individual members from representing approximately 80 different entities, which is definitely a rapid growth over the last few months. And this webinar series is a great opportunity for us to serve as a knowledge brokering platform and make sure that we're all aware of what each other is doing at all levels, be it global, regional, or national. During the last HDC monthly webinar series, we heard from the WHO, who presented ICD-11, the International Standard for Systematic Recording, Comparison of Mortality and Morbidity Data. We've also heard from USAID, Digital Square, GIZ, and UNICEF, who have presented a complementary set of research and resources addressing how countries have been and can adapt digital tools and technologies to support COVID pandemic response. And today we'll be hearing from PMI. PMI has partners with Digital Square at PATH to engage national malaria programs and other crucial stakeholders to understand the current digital environment and define country-specific priorities for using digital technology in community health programs. This session is going to be an hour long. We're going to have presentations and an opportunity at the end of it for some Q&As. And during this 1 hour session, we hope to introduce PMI's Digital Community Health Initiative. We also hope to familiarize ourselves with the current role of digital tools in delivering quality health services at the community level in 4 different countries, namely Cameroon, Kenya, Malawi, and Tanzania. And we also hope to develop an understanding of key findings and recommendations for improved service delivery using digital tools for cross-country analysis of PMI's 27 focus countries. So without further ado, I'm going to hand over to Nate from USAID to take us through the presentation. Nate, over to you.
Yeah, thank you, Mwenya, and good afternoon, good morning, everybody. Thanks for the opportunity to present. My name is Nathaniel Muller, and I'm an innovation advisor with the US President's Malaria Initiative and the lead for PMI's Digital Community Health Initiative. So next slide, please, and I'll quickly walk us through a run of show. So I'll kick things off with a brief overview of PMI's initiative, and then hand it over to our partners with Digital Square to facilitate key learnings from this work in Cameroon, Kenya, Malawi, and Tanzania. And they'll also talk about findings and recommendations across all 27 PMI countries. And then hopefully we'll have a little bit of time for some Q&A at the end of the session. Next slide, please. So just a brief overview of PMI for those of you who are not fully aware of our work. We now have programs in 24 countries in sub-Saharan Africa and 3 in the Mekong region of Asia, which you can see here on the map. And our current annual budget is about $750 million. And the initiative is led by USAID and co-implemented by the CDC, a very close partnership with national malaria control programs in the countries where we work. Next slide, please. And one of PMI's ongoing priorities is really to strengthen community health systems. And this includes transforming the quality of health systems from clinic to the community to improve malaria outcomes and to extend the reach of community health services. And within this priority, some of the areas of emphasis include expanding ICCM scale-up, higher quality community data, and improved community health worker mentoring and supervision. And I think we're all aware of the global digital transformation that's occurring, with technologies evolving, infrastructure expanding, and demand for digital solutions growing in PMI countries. And so this continued transformation and PMI's continued focus on community health systems has led to the Digital Community Health Initiative, which has a vision to strengthen quality health delivery, next slide please, in the community by investing in the scale up of digitally enabled community health platforms, really with a focus on 5 areas. And the first one is equipping frontline workers with digital tools that can actually help them do their jobs better, with an initial emphasis on providing case management. Second, we want to improve access to community data in a way that provides as much real-time visibility as possible. And third, help ensure that data is actually used for decision-making across all levels of the health system, including visibility and use by community health workers and others in the community. Fourth, we really see technology as an enabler for helping drive integrated community service delivery. We want to ensure that we're not investing in siloed systems. And while we're PMI and this work does have a malaria lens, we're intentionally looking beyond malaria to other health areas to find synergies, push alignment, and help strengthen systems. And finally, we want to continue empowering community health workers and integrating them within the national health system. In addition to better equipping them to do their jobs, this will include leveraging digital payments where possible to support community health workers in being institutionalized and receiving their salaries. Next slide, please. So as an initial step in this initiative, PMI has partnered with Digital Square at PATH to develop country profiles for each of the 27 countries we support and to create a global report looking at cross-cutting trends and opportunities. And our goal is that these outputs will be utilized by our country teams when making investment decisions, as well as by Ministry of Health staff, other donors, and other partners when investing in digital community health efforts. And as you'll see, there are many great insights that we've gathered. And so now I'll hand it over to the Digital Square team to dig into the learnings from several of the countries.
Thank you, Nate. Good afternoon, everyone. My name is Anzal Schinveld, and I am the Digital Health Advisor for Digital Square on this project. And I'll be taking you through some very brief background on the Digital Health Community Initiative. Next slide, please. So we're very proud to partner with PMI and several of our implementation partners to conduct this malaria digital community health assessment. Of course, we primarily connect health leaders with resources necessary for digital transformation through alignment and co-investment, global good ecosystems, and country and regional systems. Next slide, please. And then kind of digging into the initiative itself. What does the phased approach look like that we embarked on when we started this journey? So firstly, we started by identifying across 27 partner countries to understand the digital ecosystem at the community level and then prioritize opportunities for innovation, improvement, and health system strengthening, which can then potentially inform implementation and investments to address the identified gaps. Now, this is an iterative process relating to many different methodologies and approaches and tools, including surveys and focus groups. And what we did was we partnered with PMI and the Population Services International and Intra-Health International to conduct this assessment. And all these assessments engaged various stakeholders from the ministry level to community health workers, donors, implementers, and other key stakeholders, primarily to understand the current digital environment and to define these country-specific priorities for using digital and community health tools. So in numbers, what does that look like? In the identification phase, we looked at over 600 documents. We conducted in excess of 270 survey responses, 300 plus interviews. And that informed the first phase across these 27 PMI partner countries. And then moving into the prioritization phase, that was the workshop and validation meetings that we conducted in each country, along with the ministries of health, user advisory groups, and other stakeholders, of which many are in the room today. And then on the implementation phase, then potentially looking at the support of national programs. 3 countries have begun some implementation efforts, and 24 other countries are in the discussion phase around potential implementation options. Thank you. Next slide, please. So I think it's important to identify what has been done primarily around the ecosystem enablement, that it is fully understood as an input into future activities in order to improve the collection, analysis, and of course, always decision-making and use of the routine malaria health data. So the assessment considered a whole range of things, not necessarily limited to, but things like the state of the malaria program at community level, looking at data-driven decision-making, case management, service delivery, things like the current role digital plays in supporting community level malaria service delivery, and case management. And I think also looking in certain instances a little bit broader than malaria, of course, because all of these elements are interconnected. Also looking at data-driven decision-making across the multiple levels of the data management system in each country. The role digitized data plays in informing national policies and overall decisions. Overview of governance structures, e-health governance structures, digital strategies, and then of course, not leaving out national e-health architecture and exactly where the malaria data sets and even community health data sets fit into these. Next slide, please. So in this process, and to guide the assessment, Digital Square developed a digital health for community-based management of febrile illness framework, and that's quite a mouthful, that considers the digital health ecosystem from the community healthcare worker perspective, particularly with regard to febrile illnesses. And this framework describes the desired state for community health worker use of digital tools for managing malaria and other illness. And that's a state in which community health programs leverage digital health tools to strengthen service delivery and generate that all-important data for decision-making that ultimately improves the community health programming. Of course, the goal is always the decrease in malaria morbidity and mortality, and of course, the burden of other febrile illnesses. So the framework was designed to focus on malaria, including COVID-19, although the recommendations developed using this framework are intended to support an integrated approach in alignment with delivery of community healthcare work services. The framework also provides an overview of the key components and functionalities that are necessary for expanding the use of digital technologies at the community level. And of course, these 9 components that you see within this framework then kind of feeds into 3 primary domains, which is people, governance, and systems. And that is something that you will see come out in each of the country profiles. And that concludes a kind of a high-level overview of the project background and our approach. We are very privileged to be able to hand over to our colleagues who's going to take you through the next section of the presentation. And I believe Emily will take us through the cross-country findings of all 27 of these focal countries. Thank you, Emily.
Great, thanks so much, Anzel. Hi, everyone. As Anzel pointed out, we looked at this framework of looking across people, governance, and systems across the PMI partner countries, and really did this assessment across all 27 PMI partner countries. We're going to be spotlighting findings from 4 of those countries in this presentation, but we also wanted to give you a sense of some of the cross-country findings. So we synthesized the data across the 27 PMI partner countries where this assessment was done, and we'll highlight some of the key findings and recommendations that came out at that cross-country level. If we go to the next slide. So starting with people, so again, people is thinking about the community health workers, the supervisors, managers, technical staff, everyone kind of required in that ecosystems to support digital health at the community level. And across the 27 partner countries, all of them have active CHW programs. However, in many of them, CHWs are not government employees and are not paid an official salary through the government. And in 17 countries, there are 10 or fewer CHWs per 10,000 people. So this figure here gives an example of what we were able to compare across countries. We looked at the number of CHWs in each country. So in this figure, you can see each of the 27 countries listed. The solid dot is the number of CHWs providing malaria community case management. And that open circle is the total number of CHWs, not specific to malaria. You can see in some countries where there's a really long line or a long gap between those two dots, there are quite a few CHWs that are not providing malaria community case management, and that might indicate an opportunity to scale up or train additional CHWs that are already there to provide that care. If we go to the next slide. So then some of the recommendations that we made around people at the cross-country level, we saw that it's really important to center the end user needs of CHWs, as well as the communities that they serve, to inform the design and use of digital tools for community-based interventions. So really, looking to CHWs to understand what their needs are in terms of digital tools, and making sure that they're part of that design process, and really understanding what their digital skills are, where they're located, where they're available, and that can all inform how digital health is best designed and implemented. Another recommendation was around enhancing motivation and performance of CHWs through strengthening supportive systems. So that includes, supervisory roles, management of CHWs, also through professional development and training opportunities. And then lastly, through community accountability. So having some feedback loops with the local community can enhance motivation and performance. And we saw that digital tools can be used to enhance that motivation and performance in those ways. So digital tools can help create linkages between CHWs and their supervisors, can be used to deliver training programs, and can be used to access and look at data alongside community members or community committees. And lastly, another recommendation was to support country governments to pay CHWs for their time and services. And this is another instance where leveraging digital tools can help to create efficient mobile payments if necessary. And we also recommended assessing any resulting changes in the quality of care to continue to confirm that link between payment and quality of care. So overall, digital tools can help to create a stronger CHW workforce, but it's also really important to invest in the CHW workforce and have that strong foundation to support using digital tools. We go to the next slide. In terms of governance, again, looking across the 27 countries, nearly all countries have a current national malaria strategy, and most countries also have a current national community health strategy. Some of those countries that don't are in the process of developing them. Fewer countries, although still 17 of 27, have a current national digital health strategy. So there's still some countries that might be in the process of or not yet initiated a digital health strategy. And what we also found looking across countries is that even where those digital health strategies do exist, where there's a national policy in place, they're not always fully implemented. And some of the common recommendations that were coming out at the country level in terms of how to take those strategies and really go the next step to implement or operationalize them, a lot of countries recommended developing or refining the strategies, policies, or standard operating procedures. So again, taking those national strategies and making them a bit more tactical and operational. In also many countries, 11 countries of the 27 recommended strengthening coordination, leadership, and management, including a focus on digital health coordinating bodies or technical working groups to, again, oversee that operationalization. And then another need we heard was to increase sustainable financing. So mobilizing resources to really sustain the implementation of those digital health strategies. Next slide. So in terms of governance, some of those cross-cutting recommendations were to support country governments to lead the implementation of digital health and community health strategies. So country governments should really be in the driver's seat, and that by implementing those strategies, there's an opportunity to coordinate across the various strategies. So again, we looked at malaria strategies, community health strategies, as well as digital health strategies, and are recommending that through that implementation process, it's an opportunity to find synergies across those strategies and really implement them in a coordinated or integrated way. And part of that should include engaging CHWs and other relevant stakeholders in that implementation process. Secondly, we recommended collaborating with global and or regional institutions to review and contextualize global standards and support the implementation of standards in PMI partner countries. So this was raised as an area where there needs to be more governance focus in some countries, and there are quite a few global or regional institutions that have expertise in standards and have existing standards that can be adapted and implemented at country level. And then lastly, documenting and disseminating learnings and promising practices from country experiences. So as countries are operationalizing their digital health strategies, making sure that those experiences and lessons are shared across countries. Go to the next slide. So then lastly, in terms of systems, what we saw across countries is that 21 of the 27 countries have had CHWs use digital tools to provide malaria community case management. That's not always happening at scale, but there is a lot of experience with digital tools. We also saw some limitations to the infrastructure across countries. So 18 countries have less than 25% of their rural areas with electricity. So that's just an important thing to keep in mind, is what's the infrastructure in place to support digital tools. Many tools have offline functionality or other ways of working around infrastructure limitations, but something to consider when selecting or implementing tools. And then 15 countries had a priority or recommendation of focusing on integration and interoperability of digital tools. So in some cases, their digital tools have been put in place, but are not always connected to the overall enterprise architecture or have interoperable data. And this figure shows just across some use cases we looked at. The top third of the figure are malaria specific use cases. And the dark blue bar shows the number of countries of these 27 PMI partner countries, the number that have used one or more tools for this specific use case or functionality. And the light blue portion of the bar shows the number of countries that have a tool they're using where this functionality is possible, but not currently in use. So for example, with training health workers is one use case we looked at. Many countries are already using a digital tool to train health workers. Other countries have digital tools they're using where this functionality is possible. And so that's kind of a light lift in terms of the tools already in place. It could be expanded to also be used for that specific use case. If we go to the next slide. So then finally, recommendations in terms of systems. The first recommendation across countries was to explore new types of partnerships, such as with local organizations or the private sector, to continue to strengthen that digital health ecosystem and improve the sustainability of digital health systems. So really thinking about how, sector-wide, we can be partnering, working together to promote digital health. Secondly, define and implement country-specific enterprise architecture that includes a long-term vision for health information systems, including their ability to support integration of the full package of health services that CHWs deliver. So really thinking about, that full ecosystem, what's the enterprise architecture, how do all these individual digital tools fit into it, and making sure that we're thinking about not only kind of the immediate needs for digital tools, but also those longer term needs and more advanced functionality that you may want to add in the future. Third, advancing the interoperability of tools and systems, so across disease verticals as well as across levels of the health system, to continue to streamline data collection and management and improve opportunities for data use. And then lastly, investing in global goods. So we did see there are some global goods, which are tools that are used across a variety of countries, can be easily adapted or adopted for new countries or new settings. And there are quite a few of these global goods that are being used as software tools across a number of countries for integrated community case management or CHW management. So we recommended continuing to invest in those and support countries to scale those digital tools. And with that, those are some of the highlights from what we found across countries. And now we will dive into some of the country-specific findings. And I think you'll see some of these findings, resonating across countries as well. So let me pass it over to the presenter from Malawi to introduce yourself and kick off this section. Thank you.
Thank you very much. My name is Sam Rugama from Malawi, Ministry of Health. We'll actually take you through the Malawi presentation. Next slide, please. Okay, so for us, once we did the identification and we prioritized and the implementation, we came up with the following recommendation. But before I go to the recommendation, let me talk about the country profile. As it regards to the community health workers, we have got at the bottom line community health worker, we calling health service assistants, and they are about 9,551. And that's representing 5 per 10,000 because our total population is close to 18 million. And then in terms of compensation, they get the salaries. And then if we look at the recommendations, once we did the identification and then we prioritize, if you look at the recommendations, the first recommendation is to establish a district level electronic data collecting training, especially for the HSS. Currently, we have done the curriculum, which is a one-year curriculum training for the HSS. For the past few years, they are going a training of 12 weeks, which was 3 months, but now they will be upgraded for a 1-year training, of which the curriculum has been vetted by the Medical Council of Malawi. So the second recommendation is to support integrate community case management training for 4,000 program-specific community health workers. As you are aware that we are also implementing ICCM, and then those are the numbers that you also would like to train. Next slide. Next slide. Okay, yeah. So the other recommendation is to establish a digital health review board and then develop the interoperability guidelines. So on this one, the Ministry of Health is also working on the interoperability layer, and then at the same time is also working on integrated community health information system, which would be a standalone system at the community level because it will have all sorts of it's a platform whereby all the programs, all the initiative at the community level will be based on. And then we are also looking at developing the National Malaria Control Program health strategy. This one we are looking at for 2020 and then 2025. And we are also thinking, we also prioritize the mobilize of public domestic funding for the ICHIS. So although the Ministry of Health has conducted the situation assessment and then workflow and specific workforce specification, and then now it's working on the actually designing the integrated community health information system using the DHS2 tracker platform with the assistance from Chancellor College. And then with this one, we are lobbying for the funds so that we can, once we initiate this one, and as a country, we should be able to make a lot of progress as regards to the delivering the quality and then improving the reporting system and then the data use at the community level. And we're also looking at proof health and the mobile internet access. On this one, we are still having a challenge for the internet. especially in the rural and in the rural areas. So we are looking on how best we can engage the private sector like the TNM, the Airtel, who are the mobile operators, the major mobile operators for our country. Next slide, please. Next slide. Okay, so yeah, so the other is to develop and roll out electronic system for the HSA to use for data collection, interpretation, and use. And the lastly, we are also looking at to support end-to-end stage implementation of the data by our community health workers. That's the HSA. So we want this one to be aligned with the HIS2. Currently, we have the health management information system, which is running from the health center to the national level. But we want to make sure that we should have the integrated community health information system, which should be run from the household to the health center. And then this one should be able to have interfaces, linkages with the health management information system. That's why we have the number one recommendation looking at the interoperability, how the system can link to each other, so that at the end of the day, we just get the data at the pool. Next slide. Okay, thank you very much. That's the end of the presentation for Malawi.
Well, my name is Wilfred Bacham. I'm a titular professor with the University of Yaoundé 1. And essentially, I'm presenting on behalf of the National Malaria Control Program, with whom I work very closely. And this is because I was the national consultant for this project. It's just to say that we're about taking off. And we currently have just about 3 community health workers per 10,000 people. And although we have a national digital health strategy, we're still about to roll that out, which is why we still scored at the level of number 2 in terms of our market segment maturity. And the next slide. Essentially, because of this situation, the first thing we recommended when it comes to the people, especially of the community health workers, was to transfer the management of the day-to-day community health activities to the local council. We know that Cameroon is trying to decentralize its management system, and local councils and then now regional governments. And therefore, these local councils will play a very great role. And this would support the Ministry of Health to increase the community ownership of the community health programs at the level of these local communities. And this would ensure a strategy which is in line with the community needs. I would also support the Ministry of Health in carrying out a situational analysis and holding advocacy meetings with the local councils, which more or less also have some good amount of funding to be able to put into this system. Cameroon is planning to conduct a pilot this October, November, with payment of community health workers and community-based organizations to do the supervision of the collection of data. And the next slide. When it comes to recommendation on issues of governance, we feel that we need to improve on the digital health strategy implementation through the implementation plan and technical working group. And this would support the Ministry of Health in developing a digital health implementation plan for its 2020 digital health strategy, and which is a multi-sectoral technical working group to provide oversight for this plan. The document and working group would clearly outline the roles of different structures within the ministry involved in digital health implementation, because we're looking even beyond malaria. And secondly, to support implementation of the strategic plan for the community health and secure funds and sources for this community health worker compensation. And this is important because currently almost all the community health workers are basically focused on malaria, and then they get to do some other things. And it's important that we identify sources of funding which can help in conducting advocacy with decision makers to increase what kind of support they give the community health workers, and also going forward to formalize this operation. But thirdly, to develop the public-private partnerships for backup in electricity infrastructure. Because infrastructure in terms of electricity is very temperamental, and essentially we think that backing it up with solar banks and power banks and solar panels would be wonderful, especially now that most people turn to use cell phones that are also solar powered. In the next slide. In terms of the systems, you must understand that we have about an 85% coverage in terms of mobile network, and the bandwidth is not that great, but at least we are able to upload and download information. Electricity is it's about 24% in the rural areas and about 93% in the urban areas. And therefore, as part of our recommendations for the system, we think that we should finish updating the district health information software that currently exists in terms of data entry to capture most of also what the community health indicators actually carry. And this would support the Ministry of Health in modifying that DHS2, the data collection system at the district level, to include all the indicators that the community health workers can effectively collect. But secondly, to adopt a single interoperable tool for the community health worker data mapping collection and performance management. And this would support the Ministry of Health in developing and piloting a common digital health tool for community health workers and supervisors that provides core functionalities for data collection and performance management, and it's interoperable and with the DHSI2. During the tool development, support to the Ministry of Health in drafting the tool testing, implementation training, and management plans. We think that if we do this, it will raise us considerably in how we use digital tools in addressing issues of malaria. The next slide, I give back the floor to you for Kenya.
Thank you so much. Dr. Giduka George, the head of the Division of National Malaria Program for Kenya, and I'll do the presentation on behalf of Kenya. In Kenya, we have just above 92,000 community health workers. That is 19,000 per 10,000 population. And yes, we do have a digital health strategy for malaria. And as you can see from the map available, is that for community case management for malaria, the malaria case management is mainly focused on the areas that are highest burden, the malaria endemic regions, and the highland epidemic regions of the country. Next slide, please. And from 92,000 CHVs, around 8% of them, who are around 7,350, are providing malaria services as per the data that we had in 2017. That of course we would expect it to be better as per now. The recommendations that we have on this is that we'd recommend the support to develop an ECHIS training package and implementation plan. We do have an ECHIS training curriculum that has been implemented, including various stakeholders. And so for malaria, it will just be being able to write up on this package and the plan and to update according to ensure that all the community health volunteers, the community health workers, community health assistants are updated according to their package. We'd also like to identify and engage partners and government for post-implementation planning and strengthen the development of a community health level data scorecard and dashboard. And this will improve, the access and analysis of community health data by means of the generating and sharing cross-indicator community scorecard and dashboard with actionable activities to be shared at community dialogue and action days. Next slide. So as far as governance is concerned, at least within the Ministry of Health, we have a Kenya National Health Policy, which runs from the year 2016 to 2013. We have a National Health informatics sector working group within which this policy is being implemented, monitored, and evaluated. And we work closely, as you are all aware, that health is a devolved function within the ministry, within the government of Kenya. So we work together with the county executive committees and the county health management teams to be able to operationalize this Kenya national health policy. We also have an health information system policy that runs from the year 2010 to 2013. And this, together we work with the health sector ICT standards and guidelines within the Ministry of ICT or the Department of ICT. And we do have the data protection bill that was activated around 2 years ago. That is really key to ensuring that the data collected, reported, and acted on remains confidential. We have standards and guidelines for electronic medical records systems through the Kenya Health Enterprise Architecture. We do have, once again, as I said, we have worked with the Department of ICT or the Ministry of ICT to ensure that we adhere to all the standards and guidelines for either infrastructure. That includes the devices that we use, the hardware and the software that we use. And we recognize the need to have a trained workforce to be able to implement the same. So the recommendations that we have here is support, coordination and mechanisms for electronic community health information system implementation at national and county levels, develop policies and guidelines to guide the community health digitalization activities, and support advocacy and resource mobilization plans for transitioning EHSS support from partners to national and county governments for the purposes of sustainability as we move forward. Next slide. So I think I will share with you how the data will normally flow all the way from the community. We usually have community health units that are linked to a health facility. So they report to a health facility. The health facility is able to link to the sub-county level, and the sub-county level reports to the national level through the Health Management Information System, the DHIS2, the Electronic Integrated Disease Surveillance and Response System, and the Kenya Electronic Medical Records and Logistic Management Information Systems. But I think through the EHIS, then using the mobile application, this data can be fed directly and is able to undergo through, quality checks through the various levels to ensure that the data that ends up at the national level has been validated. The data that ends from the national level from the community has been validated at the community, sub-county, and county level before it is accepted at the national level. And this we're able to do because we have very good mobile network coverage, almost 90%. We have very good bandwidth for the mobile data. And our electricity coverage is pretty high on average. So our recommendation at this point is to develop a costed strategy for the requirements to support community health implementation, to formulate a monitoring and evaluation framework, and conduct evaluation to support scale-up of maintenance of EHIS within the current structures that exist, and support the development and expansion of the features for the EHIS to be able to cover, beyond what we are covering, to be able to do surveillance, to be able to cover components of human resource, community management, and ensure integration across all the systems, to include, to be able to track the healthcare workers' capabilities, which is actually a priority moving forward for us, to develop a supporting supervision module for EHIS, enable leakage of the EHIS and the digital health platform, to support referrals between the community and facilities, and finally to support the module for stock and commodities management that is also key for us. Thank you, and I'd like to hand over back.
Good evening, all of you. I am Halifa Munisi, Program Officer working with National Malaria Control Program Tanzania. Like other countries, Tanzania have been using these digital tools. And as of now, we have digital tools for malaria case management, but we have also digital tools for other programs, as the map illustrates. And as of now, we have about 53,000 community healthcare workers. This is corresponding to 9.8 CHWs per every 10,000 population. And in terms of national digital health system, health strategy, we has national digital health strategy of 2018, yes, that governs the implementation of digital health solutions all over the country. And in terms of market segment maturity, we still have some systems that are not really harmonized with a score of 2. And next slide, please. Yes. After prioritization, we come up with some recommendations. And in terms of people, we need to have a guidelines that will help us on identifying, recruiting, and engaging CHWs on digital healthy solutions. And in terms of support the development of on-the-job training, mentorship, and support for CHW digital tools, we need here to establish a routine mechanism that will provide the digital health support to this CHW and enable them to utilize these digital solutions as need arises. And in terms of data dissemination and use, apart from collection apart from collection of this data, is our wish to see these CHWs utilizing malaria data to have informed the decision making on different malaria interventions. Next slide, please. Yes, and our recommendations in terms of governance, enhanced leadership and governance for digital health CHW. We need to have a coordination body that will involve community leaders, implementing partners, and well as central government officials. And this will oversee the combination of all digital solution systems at the community. And with this, will ensure every interventions utilizing digital solution be aligned into the same or harmonized digital systems. And if in case of supporting expansion and guideline for on CHW roles to include malaria case management, it's our wish to see CHWs fully engaged on malaria case management, especially at health care delivery facilities, including adult shops. So we are working with we are exploring the possibility of CHW to be engaged on malaria case management. And in terms of data review and use guidelines at the community, we are working, we are looking forward to review and use health data at the community level to ensure that we have a mechanism in place for information sharing and feedback in regards to data collection use and so forth. Again, strengthening data privacy and security guidelines for community health. As we all know that data is very sensitive. So we need to have guidelines in place that will regulate data privacy, security, and the sharing as well. Next slide, please. Well, and in terms of systems, harmonize data sources to reduce duplicity and improving data collection efficiency. As a country, we are looking forward to develop integrated community level data collection and the management tool that will work in a very harmonized way, in such a way that it will reduce duplicity, having several vertical data, digital data collection tool. And in terms of enhancement of the community digital health systems for case management and surveillance, as of now, we have this, what we call case-based surveillance that is using, digital systems, but also we have another one for malaria case management in high burden regions. So as a country, we are looking forward also to enhance these systems to ensure that they really collect all key digital data at the community and the facility as well as per government requirements. And again, in terms of as a country, we have a DHS2 that is warehouse for routine healthy data. But again, we have a malaria composite database that is, responsible for aggregating non-routine data that are non-facility-based data. So we are looking forward also to support this area to see how best a digital system, so long as they are non-facility based, they'll be well aligned with the existing malaria composite database. Thank you.
Great. Thank you so much to all of our presenters across the 4 countries. It was so great to hear more about all of the rich work that's gone into these assessments in the countries. And I know that's bringing us up to almost the end of the hour, and understand some people might have to drop at the hour, but we are happy to stay on and go a few minutes beyond the hour if there are questions. So there's a little Q&A box at the bottom of your Zoom screen where you can submit any questions. So feel free to type any questions in there. I saw a few questions come up in the chat around making some of this information available. So just wanted to make sure everyone saw the links that got dropped into the chat. So the webinar recording and slides will be available on the Health Data Collaborative website, which is healthdatacollaborative.org. And then Nate also dropped in the link to the Digital Square website where each of the country profiles lives. So most of 3 out of the 4 countries that presented are already up there, and the other will be added shortly. And you can also go there to see the profiles for all 27 of the countries, the PMI partner countries that were part of the assessment. So with
Thanks,
that,
Emily.
thank you.
I noticed there was a couple of hands up while we were talking. As you mentioned, we can stay on for a couple more minutes. Godfrey Bampinga had his hand up. I'm not sure if you want to go ahead and speak. The line is open. You should be able to unmute yourself. Go ahead, Godfrey.
Yes. Hello.
Yes, please go ahead.
Sorry, the hand was earlier raised much earlier, but I think during the presentation I was able to receive what I wanted to hear. So it's okay, but I'm only requesting that if you can make the material available, the presentation and also the recording available for us to review. Very, very intuitive, and would like to really go through it. Thank you very much.
Great, thank you. And as mentioned, the presentation and the recording we've made available through the Health Data Collaborative website. I also noticed Jean-Pierre had his hand up. I'm not sure if Jean-Pierre Delamal is still with us, but I know that he did have his hand up earlier on. Jean-Pierre, are you still with us? I don't see him on the list. Great. Great. So if there's no more questions, should we go ahead and close, Emily?
Yes, we can go ahead and close. Thank you all for the time, and thank you again to our presenters.
Thank you once again. Enjoy the rest of your day, everybody. Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thanks. Bye.
Thank you all. Bye-bye. You